This is Dr Najeeb Ahmad Rumi uh, from London, and my introduction is that I am a medical doctor with a specialty in mind well-being. Uh, Today is very prevailed human emotions. We are going to discuss, as you can see in the title of this subject, which we are going to discuss, is anger management. Because it's very common nowadays, every person's beyond any age group or any gender, it's getting worse day by day. But I'm very much optimistic and very much positive about this emotions, anger management. Because you may have lots of information about what is anger. This is very common human emotions when we are upset, when we are angry. So it's very common. Obviously, there are two reasons. Is The most important reason is that when there is some obvious cause, when there is obvious cause of getting angry or upset, so it makes sense that we are getting upset, we're getting hyper, because out of the reaction of that obvious reasons and cause. So today we will discuss about how to, because the problem is is with with me as well as with anyone, because it's human emotions. So now I wanted to correlate this emotion with because the topic is anger management with your emotional wisdom. Because emotional wisdom, as we are discussing, and I'm taking my uh, morning coffee. Yes, in London it's morning. So emotional wisdom, because first we wanted to discuss about various types. There are many types of wisdom, intelligence. You may well aware of all these, you know, types of wisdom. So today I'm not going to teach or going to discuss, because as you all are well aware of, this notion that this is not boring lectures, but it's something, because this kind of talk is only for me and for those who are seekers, who want to seek something. So, emotional wisdom, because yeah, we wanted to discuss, because then step by step we will go forward, so that when you are uh, in a better place and positions to understand, then it would be really very uh, helpful. It would be a very helping, you know, way to approach there. So three uh, types of wisdoms, because you may all aware of IQ, because it's your intelligence question, your intelligent capacity, how much intelligent you are. But today I'm not talking about your physical intelligence, your brain intelligence. Today our topic is emotional intelligence. What is that emotional intelligence? Your physical brain intelligence is there. But today our topic is emotional wisdom, which is called EQ. IQ, intellectual quotient, EQ, emotional quotient. Emotionally, how much wise you are. And when you are emotionally wise, then you are in a better positions to manage your anger. Emotional wisdom is all about yourself. And then obviously there is another form of wisdom, which is spiritual question, SQ. So there are three types of wisdoms: IQ, intellectual question, which may be various, is vary from person to persons. Is your emotions, how much emotionally balanced you are, how much emotionally intelligent you are. So your emotional wisdom is very important. And then obviously spiritual question ask you, spiritually, if you are spiritual quotient, spiritual wisdom, as the definition of World Health Organizations we have discussed in our previous talks, that health is a state of complete well-being, and um, with all of holistic approach of health is a state of complete well-being with your four dimensions of health according to the World Health Organization. What are those uh, four dimensions? Physical dimensions, mental dimensions of health, social dimension of health, and spiritual dimensions. So my neuro-narrative therapy is totally based on this correlation with our neurons, with our mind, with our brain, and how we are going to make a narrative. And with this narrative, neurons, how, because as you know, that sympathetic nervous system, parasympathetic nervous system is the messages, motor neurons taking all of the messages. It may be with our five sensory nerves, seeing when we see, listen, touch. So all of smell. So all of these five sensory perceptions are taking messages through various forms with the help of your vision, outer eye, listening some messages is your auditory, you know, motors. A message is going to our brain, taste, touch, smell, visions, five perceptions. So these messages are going to our mind, and as I have mentioned that it is processing device, our brain, what comes into our mind and our brain, it is properly being processed. What's going on? So this is alarming thing when we smell some fire smoke. Then we just receive the message because obviously if it is not in front of you with through uh, the sensory perception of your olfactory nerves through smell, then message comes into your mind, into your brain, and is being processed, and it is alarming situation for you to be alert to take some measures. So similarly, when messages are going directly or indirectly through sensory perceptions, then what we do, we make a narrative. That's why my theory and therapy is neuro neurons, brain, narrative. You make some narrative, so it makes sense that we need to take some pragmatic action to undo if it is alarming situation, if it is bad situation, and because controlling is your brain, controlling device is in your brain through messages, motor nerves and sensory nerves. So neurotransmitters are there giving messages, receiving messages, and getting you alert and alarm about the situation. Is it clear? So, because I always, during my talks, I always share my thought that the only person who can heal or harm you is yourself. Try to be helping hand. Try to be your own healer. So, as you can, because I'm not talking about anger, and I'm just solution oriented mind. Intrapersonal wisdom is refers to understand your internal personal wisdom, which is very important. This is the basic philosophy, which at the end of this talk, then you would be in a better positions to perceive and understand the real meanings. Because it's, all of my talks are totally based on scientific research, based on self evident research, because I, I, I studied myself. The first case study which I gone through all of my research and all of my studies, I studied myself. Case study was myself. So these are all of the experiences, self-evident based, because in emotional wisdom and the lack of emotional wisdom, this could be with anyone, because we are human beings. We are living in this world, but this is our open choice to manage our problem with our solution oriented mind here, neurons, and then build up a narrative, write it down, what's going on, and most importantly is to take action. Obviously, when you are in pain and suffering, headache or body ache, what would we do? We need to go to doctor or at least non-prescribed medicines, painkiller, analgesic, then our mind, because we can't see the pain, but we can feel invisible pain in our body, physical pain in our body. So, what measures and what steps we take is we just go for medications or meditations. If you it's not a severe type, then you go for yoga, mindfulness meditation, relaxations. If you are tired, if your pain is associated with various things, then obviously then the right persons, because it is your intrapersonal state of affairs. What are you feeling? How are you feeling? If you are self-compassionate, if you are full of empathy, self empathy, being empathic and being helping hands for others, and you are ignoring yourself, again, is a form of self cruelty. So, first, you have to be self kind with your compassionate mind. Then you have to help others. If you are ignoring yourself, self negligence, and you are helping others, it's again form of cruelty. Or if you are self centered, both things are very important because to perceive and to understand the notions, then you would be in a better positions to think, neurons, narrative, rewrite, write, rewrite. And final draft is when you are taking action, whether your theory narrative is practicable, pragmatic, and based on selflessness. So when you are someone is self-centered. Again, this is a negative approach. You are arrogant. You are proud of in a negative way that you are filthy rich. You are well off. Being well off is not a problem, but being rude and ignorant about others is form of, you know, is form of serious kinds of humiliations of human being. So self-centered approach when you are greedy, selfish, you only think about yourself. It is again an alarming situation. So which is directly linked to your anger. Because one of the great philosophers said that arrogance is a form of anger because you are not intelligently emotionally. There is acute lack of your emotional wisdom, your internal personal wisdom, which is understanding your emotions, refers to, we have mentioned, it's referred to, you can go through my descriptions of this talk. So, so in this way, when you are, first you have to read yourself, what's going on with your empathy, with your self compassion and self love. Don't get upset, don't be rushed, just relax, think with your brain and mind. Want to change yourself, then it's open choice. Good opportunities to practice your health and well-being because health and well-being practitioners are not only the doctors who are dealing with this. You can be your health and well-being practitioner means that you are practicing your health preventions through your kind mind with your kindness of your emotional wisdom. So intrapersonal wisdom, as we have mentioned, you have to read your mind. For that purpose, you don't need any philosophy, you don't need any psychology, you don't need any social behavioral sciences to study. You even don't need any qualification or knowledge. You are highly qualified to read your mind book like this Facebook nowadays. It's very common. Everybody, majority of people on the globe, they are using Facebook, social network media. But unfortunately, we are not reading that book. Facebook, we are just going to reveal what's going on into our mind. Means we are not reading, we are not going through the stuff which is into our mind, but we are putting it through our inbox and whatsoever I'm writing, we are writing, and it's going through and the other people. That's why we are being victimized. We are being controlled. So you have to study yourself. You have to study your emotions. You have to read your mind book. This Facebook is preface, preface of your contents of your text, context, context, index of your book, which is here, mind book. And I always say, mind your book, mind book. When you get it, realize that uh, you are for that purpose because we are preoccupied all the time reading, studying, earning problems, because lots of deprivations, lots of issues, health issues are directly related to our deprivation of economical health. As I have mentioned that economic, one of the most important dimensions of our health is our economical dimension of health. So that's why just uh, we have been taken away from the real context of our mind book. That's why it's going to pile up with the passage of time through various problems in life. So then we wouldn't be in a positions to read our mind because proactively we are using our conscious mind. Of course, it's a need, pre-conscious mind, and then we already don't have any access to our unconscious mind. All everything is lying, going to pile up there. So we, for that purpose, we need some meditations. We need some time for ourselves. That's I use the me time as my time, like tea time, like coffee time, in order to read your mind, in order to have some know-how what's going on into your mind. That's why it's my neuro-narrative therapy. Neurons, yeah, and then you have to read through nerves what's going on, and narrative you have to write it down in your health and well-being diary. You have to keep a diary, health and well-being diary, because what we are doing, we don't know. It's very short duration of life. Even if nobody knows if you are healthy, even then the heart can be stopped. And God forbidden, maybe due to any cause. But right now we are living at this time. But the two systems of our mind are in operation. One is motor neurons, the messages going here directly nowadays, directly associated with social network media, sleeping, walking, talking, eating, drinking. 24/7, we are strongly adherent, associate, and badly involved in that form of medical science revealed that it is now they have added up another form of addiction. Screen, gadgets, social network media addictions. I'm not against this, but I'm not in favor of addictive behavior of social network media because there are lots of merits and demerits of using social networks. It's very informative, very helpful because when you use it properly, you're sending email and sending all of the posts and all of the informations. It's just very knowledgeable. But when you are only going to be liked, shared, and prescribed, and just prescribed, prescribed, use prescriptions being a doctor. Prescription is when doctor is writing medicines for you. Although I'm not drug prescriber, I'm social prescriber. What is a social prescriber? Is like today we are talking anger and stress management. So how to manage it? Not through drugs, because if you are angry, if you have emotional imbalance, problem with your emotions, but if it's very common, it could be with anyone. But the best thing is, because it is not a stigma, mental health issues like physical health issues, like other health issues, it is one of the form of mental health, mind health issues. It could be with anyone. You need to seek them the best advice from your registered doctors, registered practitioners. So, as we are going to discuss social prescribing, socially, emotionally, intellectually, and your internal personal wisdom. You can you can be a good anger manager, anger management. But as manager, you the person who is going to manage the things. Try to be yourself anger manager appropriately in a sensible and reasonable way, because the only person who can heal or harm you is yourself. Try to make your life easy, busy, happy, actively by using your mind book instead of all the time you're using your Facebook, social network media. That's a good you can use. I'm not against social network media, but I'm not in favor of addictive behavior. 24/7, you are going to ignore your health, you're going to ignore your family, you're going to ignore others. time you are having addictive behavior. So it's alarming situation. So coming to our point is anger management through intrapersonal wisdom. Because when you use, you have to read here because it's never ever too late to start living happily, to start living free of toxins. There are two forms of toxins: physical toxin in our body and toxin in our toxicity. It's very dangerous when it is in our thought, in our behavior. Because star techniques, last time we have discussed in my previous talks, what is the star techniques? That is S stand for situation, whatsoever the situation. Because today our topic is anger management. Why you are going to boil up? The trigger point is the situation, and then T. T stand for thought process. Practically, when you read your mind, you have to perform something because psychodrama is one of my favorite uh, modules and technique in neuro-narrative therapy. To use psychodrama, you have to perform yourself in order to manage your anger. Why you are upset, why you are going to ignore yourself, you are taking care of yourself in terms of your personal hygiene. What is that personal hygiene? You early in the morning you need to take care of having 2-3 glasses of water. If you don't have any medical conditions or problem like I do, then open your bowels, wash your face, clean your oral hygiene, hair, and then if you don't have beard, then you need to shave or properly clean your. And then second thing is when you before you go to your work, you need to have proper dress, neat and clean dress. Proper doesn't mean that you are looking for very expensive clothes and shoes. No, neat and clean, impressive, which appeal you. You should dress up in a proper way, not to show it off to others, but it's for your own satisfaction. So this is personal hygiene, personal management. Then you will see that you are going to, you need to bring a change inside of you because routine work will never ever stop unless or until you have to think and change, because there are two pilots in operations, as we have discussed. Two sympathetic nervous system is sensory and motor neurons in our central nervous system, in our uh, mind, and it's in our backbone. It's medical terms I'm using, but it's very simple way that our brain is controlled by, because motor and sensory nerves, and another is parasympathetic nerves, automatic pilot. What is that automatic pilot is with? Because like animals, they don't think about the things. When there is a night, they go to nests, they go to their whatsoever the source of their nests are. They, in the evening time, they just go there, and when they are hungry or angry, they, mm, of course, it's biological need they go for having their food, what kind of food, and then they have a sleep. So everything is in biological need, instinct, or they try for mating. So this is the approach of an animals, which is according to the Professor Sigmund Freud's, that unconscious mind consisting of our biological needs. So this is something which is known as automatic pilot. Automatically, there is a night, then we have to go to bed that we need to take if you don't have any night duty, night shift, or whatsoever, if you have some programs. Otherwise, routine is con- automatic pilot, is we are breathing, we are seeing, conscious mind, thinking. But it is automatically, it's a process. Like breathing, breathe in and breathe out is automatic pilot. Yeah, it's working. We can see, we can listen, all of the five perception. And another pilot which I have introduced is very important, and it is very, essential point in my mindfulness meditations, in my neuro-narrative therapy, theory and therapy. What is that? Automatic pilot. Automatically, you are breathing, going, thinking, going to bed, getting up early in the morning because its alarm is it's here. You you have your inner diary here. If you don't have any, God forbidden, memory problems. So another form which I have derived and I have introduced is controlled pilot. Automatic pilot, sympathetic nervous system, breathing, listening, seeing, enjoying, getting um, upset, emotions, whatsoever. It's automatically, it's autonomic nervous system, automatic autonomic nervous system. Controlled nervous system is our today's topic of discussions. Control pilot. What is that control pilot? Is your mindfulness. You are sparing a time for yourself in order to manage your anger, in order to manage your emotions with the help of with the help of your intra-personal wisdom, internal, inner personal wisdom, which is everything. One of the great philosophers, what he said that yesterday I was clever. But he said yesterday I was clever. Why? He said because I wanted to change the world. I wanted to change other. Then he said today, because everything is all about today, right now, at this present moment. Then he said, today I am wise. This is your internal personal wisdom. He said, I'm lucky. Now I am wise. So I wanted to change myself. This is self management, to manage, to control your anger. When you have some know how about the things, when you know there is some ticking bomb or there is explosion somewhere, and you are aware of that thing, that something bad is going to happen, then what would be the end result? You guys would be extraordinary vigilant about explorer, the exposure and explore of that not bad, or you can say any bad happenings when you are not aware of, through ignorance, to negligence. You damn care about the things what's going on here. 24/7 you are using your reactive mind in order to uh, become rich, in order to you are very much focused on the quantity of life. Now two things very important: quantity and of life. Quality of life is all about, quantity is important, you have to earn in a reasonable way, and then quality of life is all about yourself, how you're going to take care of yourself. Like when I use the vehicles, our uh, vehicles, how much vigilant we are in terms of the fuel, number one, in terms of the water, if we put water, in terms of if it is electric vehicles, we need to we are very much careful before going to start our journey. We need to check all of these, important things for the engines to work properly. Similarly, when we damn care about this engine, brain, then we are upset, we are angry, we are reactionary, we are revengeful. You can name it. We have sleep problems, we have eating problems, we have drug addictions because we are not taking care of our this engine. So this is neurons. You have to read your mind, rewrite, write, rewrite, make a narrative, how you can help yourself. If your preference is when you have some problem, as for instance, if somebody is, God forbidden, having diabetes or high blood pressures, instead of preventing from something which are going to increase that problem, as for instance, if somebody has diabetes and the doctor advise him or her to be careful about consuming sugary drink or having ice cream, cakes, or that stuff. And instead of he or she is on medications, and then they are ignorant and they say, okay, because our choice is we will take something more sweetie, and then during night time, and I will take my pills, and then I will increase my dose. This is the ignorance. And similarly, when you are angry and your blood pressure is high and stressful, and you damn care about your sleep, you damn care about your time management, you damn care about your relationship, because automatic pilot is there. You are just on pills and sleeping pills, and you are taking drugs. But the best medicines is all about healthy lifestyle. In my previous talk, I mentioned, I shared, use your active mind, read your mind book with mindfulness, and accept yourself with your strength and weaknesses. In terms of strength, you have to appreciate, give present to yourself, tiny things. Appreciate yourself that, oh, you're doing wonderful things, you're doing a wonderful job. And in this way, my dears, you can read your mind book, or you are upset today, it's never ever too late to start living healthy, happily, right now at the present moment. And you need to give benefit of doubts to yourself whatsoever, because past is not a place to live, because it's everything is associated with different things. It's weird thoughts, linked to, because here, in our mind, if it is full of polluted thoughts, if it is full of hatred, revengeful attitude, because if you want to keep yourself happy, you need to speak kind words all the time. I'm a behavioral scientist. I'm doctor. Before I was medical doctor, then I switched over to prescribe mindfulness because I use for myself. Because this is medicines. What is difference between medicines and drug? Healthcare is when you go to the hospital, they always say this healthcare. No, this is not healthcare. That is sick care. When you become sick, secondary, tertiary prevention, secondary preventions, primary or primordial prevention is all evolved from the beginning. Or if you have some, because it's never ever too late, you have to think, because it's a pandemic, anger, stress, depressions, you can name it. When you are angry and you have lots of justification in your mind, oh, because you are saying, oh no, I'm just, it's my family traits, I'm proud of this, and because my family, my daddy, my grandfather, whatsoever, they were, because it's family traits. No, no, no. It's a disease, my dear. Anger, hatred, extremism, out of anything. So, this is narrative. You have to read your mind, why you are upset. Keep a diary, anger management diary. Why you are upset today? Why you are not going to appreciate? You are hitting people. You are screaming, shouting out of any reasons or without reasons. If there is a reason, then obviously and of course a day will come when you will get upset without any reasons, without any obvious cause. Why? Because here, automatic pilot, automatically you will be upset. That that would become your unhealthy lifestyle. That would become your habits. And how then, when you have bad habits, when you have addictive behavior of getting upset without any reasons, then it will lead to serious consequences. Because here, if pollution, polluted thoughts, toxicity is here, and it's circulating through your blood, all circulation inside of your bloodstream. When you are upset, when you are angry, as we have discussed, is directly linked to our negative chemical reactions, chain of chemical reactions. When we are upset, it means that we are going to circulate automatically negative chemicals inside of our body, which are very harmful, like cortisol. When we are angry, when we are upset, look at your face. You look like very wrinkles and very, it's very upsetting, unpleasant face and unpleasant body. And even then, why? Because due to chemical reactions inside of our brain. What are those chemicals? Cortisols. It's very negative and disturbing, painful chemicals. And lactic acid formation. You feel that you're tired, your legs are really, it's very painful, headache, shoulder pain, neck pain, you can name it. Then you go to your GP, your doctor, asking that, oh, I have got problem. Then he will take your history and he will say, okay, what have you had for your food? You'll say, I'm not junky, I'm not having junk food. But you will never ever disclose that you are upset, you're angry, you are using your because you would believe that it's a normal thing. No, a good doctor will ask about your even emotional health, because I always give example. A good doctor treat the disease, only disease, but a great and philosophical doctor, mystic doctor, therapist, treat the patient with disease. The good doctor treat only the disease, your problems. You will be free of problems. But the great and mystic doctors, real and although every person's there, I'm not talking about, I'm not making any comparison, but the real thing, the compassionate and mystic doctors, they will treat you like they are treating their own family members, because we belong to one family, isn't it? One species, human. No question about your region, race, color, socio-economical ups and downs, sexuality, believing in God or without any belief. But we are one family, global family. So the mystic and the compassionate doctors will treat a patient first. He or she will ask you various questions about your emotional health, about the mind dimension of health, why you're upset. And he or she will give you, if they are practicing a prescriber of drugs or medicines, then they have to ask you to be in a better positions too. Because I remember when I was a child, my father, he was a medical doctor. He graduated from Nishtar Medical University. And what he would do, that he always advised, take all of the history first before giving them medication or prescription. That was all about try to keep self, try to have. He just advised that you must have good food, and with your good mood, you need to go for a walk. You think positively, act positively, and that's it. So from that day, I remember that mystic and real help of your therapist is doctor is they always are concerned, because what is the meaning? Family physicians. Why the doctors they are called family physician? Although not all of the physician, surgeon, they are different doctors. Family doctor and family physicians are those great people who help you to be in a better positions without medications, without drug. What is that? Because Sir William Osler, who was in here in England, he was one of the most popular, got the title of Sir William Osler, who was our medical doctor in the UK. Sir William Osler's his quotation is really, it's very, I need to write it with golden, words. What he said that the most important duties of a physician, of a doctor, of a family physician, is to educate the masses, is educate his or her patients not to take medications. What does it mean? It doesn't mean that if you have some medical conditions, you must have to take drug or medicines as prescribed by your doctor, by your GP. But it was all about prevention. You have to lead a healthy lifestyle through healthy mind, through walk, through having good food, yeah, food for body and food for thought. So, because the role of, I always mention in my previous lectures that role of a doctor and physicians and therapist is not done when his or her patient is cured, but when the patient, he or she, is insightful, mindful, self-actualized, when they are in a better positions to exercise and to maximize his or her potentialities and interacting with the world in a satisfactory way. That is the real job of a doctor, which needs to be done when his or her patients, service user, are insightful, mindful, self respectful, and interacting with the world in a satisfactory way. So, anger management, you have to read your mind why you are upset through meditations with controlled pilot. Automatic pilot is there, you have lots of justifications, and you will start screaming, oh no, I was right, he or she was wrong. No, write it down. You need to give benefit of doubts to yourself, and if you want to keep yourself happy, free of anger, you have to speak kind words always. It's medicinal, it's a therapeutic meditation. Write it down in your diary. Speak kind words. Forget and forgive other faults. Somebody is disturbing for you, somebody did any bad thing with you, you have to forget and forgive. Number two. Number three, extend helping hands. Whatsoever you can help someone without any give and take. This is self compassion, self love, self respect. When you adopt this lifestyle, believe in me, I'm just sharing personal self, evident based things which I'm going to share with you. I have lots of stress and depression, but I can manage with my controlled pilot, with my mindfulness meditation, with my yoga, with my exercise in the walk in the park, sharing my positive thoughts or whatsoever my thoughts with my dearer and nearer, with my friends. And I'm not using my reactive mind here. When you use your reactive mind, it means you have lots of justification for your anger. But when you use your active mind, because anger, I have discussed it in my descriptions, that anger is self punishment out of the faults of others. If somebody commit faults and you are punishing yourself, this is anger. You need to manage your anger in this way. So, so try to accept yourself with your strengths and weaknesses. Accept and respect. Take action in order to avoid addictions. A day will come then your emotions, addictive behavior would be your lifestyle. You would be aggressive persons, and your mind will give you, thoughts will give you lots of justification. Oh, it's my lifestyle, I'm very much arrogant, I'm very much intelligent. Being proud is the indication of your anger. You're proud, you're arrogant, that's why you're angry. Selflessness. Try to be a changed person in order to break that chain, in order to break the vicious circle of self praising of self, selfishness. Changed, self surrender. You have to accept yourself, love yourself, speak kind words, forget and forgive other faults. And you will be happy forever. Uh, that's all for today. If you have any query and questions, feel free to get in touch with my WhatsApp number, social network media, Twitter, or you can send me an email. And all of these information according to DGPR, Data Protection Act, would be highly confidential because it's something I'm not asking about your age or your personal things. Just it's a general talk about well-being. It's free of cost for less well-off. If someone is in England, or because I can give online therapeutic treatment. If somebody needs, then um, I will let them know about my charges. Otherwise, it's free for less well-off or free for everyone because my notion is health and happiness forever for all. We have to raise because this is the basic, needs and a primary, award, reward for everyone. Basic health, basic oxygen, water, pure shelter, food, safety and security, self-respect, self-esteem, safe sex, and then self-actualization. Take well care of yourself. Then see you next time. Take care and take care of people around you. Take care and bye bye. Bye bye.